Hello everyone. Yeah. Hello everyone. So today we will be hosting our first event of the MISx Student X Talks. I'm very proud to announce that we're actually doing this. And this has been a long journey with getting everything sorted out, and I'm very happy to get this sorted, and I think this is going to be a great event. I really hope everyone enjoys it. We will be first starting off with Bayne with eating disorders. I think this is a very important start. So I want to say thank you to everyone for joining and being in this event. And I hope that you get something from this and you not only discover and learn new things, but you actually get something that will be inspiring, and hopefully you can do something similar to what these people are with finding stuff and trying to make a mark or an importance in their society, their community. Thank you very much.
Good afternoon, everybody. I'm going to be starting off today with stating some numbers. 30 million. 30 million is the number of U.S. citizens estimated to be struggling with an eating disorder. 9% of the entire world's population is struggling with an eating disorder, but approximately 1 in 10 will only ever receive treatment. Johns Hopkins All Children's Hospital states that 95% of the patients that they receive with an eating disorder are between the ages of 12 and 25 years old. And according to the Eating Disorder Recovery Clinic, the rate of children under 12 being admitted to the hospital for eating disorders rose 119% in less than a decade. With the highest mortality rate amongst mental illnesses, there are 10,200 deaths each year, making each death approximately 52 minutes. So, what is an eating disorder? An eating disorder is a mental and physical illness categorized by unhealthy relationships with food and serious disturbances in eating behavior. An eating disorder is a mental illness but is influenced by both biological and environmental factors such as trauma, sports, pressures to have a certain body type, and even family dynamics. Most of the time, they are found to be linked with people who are perfectionists or have some kind of OCD, like they need to be perfect. There is no specific body type, race, gender, or age that it affects, meaning the person with an eating disorder could literally be sitting right next to you. It could be your best friend. The most common types are anorexia nervosa, bulimia nervosa, and binge eating disorder, so I will briefly introduce you to them. Anorexia nervosa. People with anorexia restrict their food intake and have an intense fear of weight gain. Patients also have comorbid anxiety disorders, including obsessive compulsive disorder and social phobia. Some health risks are death, cardiac complications, heart, kidney, and liver failure, bone loss, osteoporosis, anemia, electrolyte imbalances, low blood sugar, constipation, bloating, and other gastrointestinal issues, amenorrhea, fertility challenges, low testosterone, and approximately 1 in 5 anorexia deaths are committed from suicide. Bulimia nervosa. Binge eating followed by compulsory purging or other methods to avoid weight gain, or to relieve the physical symptoms that a person feels after binging. Purging usually involves vomiting, but it can also include the use of laxatives, over-exercising, and diet or fasting. People struggling with bulimia have risks such as believing thinness is equivalent to beauty, which is thin ideal internalization, having negative body issues, body dissatisfaction, also commonly referred to as body dysmorphia, perceiving pressure to be thin, and dieting. 5% of American women will suffer from bulimia nervosa in their lifetime. Some health risks include cardiac complications, dehydration, edema, loss of potassium, sodium, and chloride in the body, ulcers, pancreatitis, esophageal inflammation and rupture, tooth decay and staining, digestive irregularity, fatigue, muscle weakness, and risks associated with diabulimia, such as organ damage and peripheral neuropathy. Binge eating disorder, the most common eating disorder. Approximately 8% of American citizens will suffer with it in their lifetime. It's recurrent episodes of eating large quantities of food, often very quickly to the point of discomfort, a feeling of loss during the binge, experiencing shame, distress, or guilt afterwards. Some health risks include weight gain, obesity, high blood pressure, high cholesterol, heart disease, type 2 diabetes, and emotional and mental distress. So now that we have a brief understanding, we can go into the physical effects. Eating disorders lead to severe malnutrition that affects nearly every organ in the body. Malnutrition can cause dangerously low heart rate or abnormal heart rhythm, leading a person to feel dizzy, pass out, or the heart could ultimately stop, causing death. EDs are commonly linked to irritability, mood changes, and difficulty focusing. Stomach and intestines are working slower, leading to pain, constipation, and bloating. Bones become brittle, hair is thinning, and death. A person struggling with an eating disorder may experience body dysmorphia, uncontrollable thoughts of food and calorie intake, and overwhelming levels of stress. Depression is very common, as well as self-hate, mood swings, and anxiety. Family and friends are turned into monsters, and the relationships often experience a lot of strain. Immense guilt can form in their minds as foods are labeled between good and bad. So what can you do about this? In order to help a person suffering from an eating disorder, you can do a few things. You can understand them. You can get the knowledge about what it is, and that you can understand it is not their problem. It is a mental illness. They did not choose to have this. You can support the person by being there. You don't demean anything that they say, how they feel. You can let the person feel as though they are not alone. You can be someone who they feel comfortable talking to with. A support system is key in recovery in order to make sure that they actually recover. When a person in recovery starts to panic, you may calm them down or reassure them that they are going to be okay and that you are there for them. You can encourage recovery. Encourage the person to recover. Celebrate the positives and little wins. Do not degrade a person for a mess up. If the person is starting to relapse, remind them why they must recover for both their mental and physical health. Comments, you have to be very crucial when you assess this area based on the person trying to recover. Comments must be made carefully. Try not to make them feel uncomfortable. Avoid saying phrases about weight changes such as, "You look healthier," "You look great," "You're filling out those jeans nicely," because those can be interpreted differently in the eating disorder's mind. Try using phrases like, "That shirt looks nice on you," or so the person doesn't focus on their body insecurities. And absolutely never comment on the food that they eat, when they eat, how much they eat. They are already filled with negative thoughts, and they do not need your comments as well. be there. Recovery takes time and is an emotional roller coaster filled with ups and downs. Be their shoulder to cry on. Be the person who they FaceTime just to talk about how they're feeling when they have an overwhelming thought of guilt. Be the person they can dance with when they are happy, and the person who nudges them when they're starting to relapse. Recovery is a long process, and you need to be patient with them as they are dealing with a severe mental illness. Do not take eating disorders lightly. My name is Bayne, and this has been my MISx talk.